to a motor vehicle collision with a pedestrian on Woodruff and Baseline. Fraud negative on the phone. Police are there doing traffic control. There is a bystander witness who is the brother of the casualty.
Okay, so the police are doing the traffic control, but I'm also going to make sure that they're keeping pedestrians or bystanders away, just so I can focus on my patient. Is it today's date and weather?
Yeah.
It is. So it is dark outside, so I'm going to make sure I have the floodlights on the ambulance and I have my PPE on so everybody can see me. I'm going to make sure that I bring a blanket for the patient because it is cold outside, and I will wear my jacket, and so will my partner. So the mechanism of injury is a pedestrian has been struck by a car. It seems to just be the one casualty as of right now, but there could be more, so I'll continue to monitor. Allied agencies, I have police on scene. I may need fire, so I'll call if I need them. And the PPE, I'm going to make sure I have my high vis, and I'm going to make sure I'm going to have my gown, my gloves, and my mask because I could be dealing with blood, and I will wear my my face shield or my glasses if I need them. Okay, so I walk up on the scene. Who greets me?
The brother.
Hi, my name's Aidan. I'm a student paramedic. This is my partner Camilo. What's your name?
Nick.
Hi, Nick. Can you tell me a bit about what happened here?
Yeah, so my brother was just walking through the intersection, and some guy was speeding, and he hit my brother.
Oh, I'm sorry to hear about that. Can you tell me a bit about how fast they were going?
Yeah, I think about like 70 kilometers an hour.
About 70, okay. Before I approach you or your brother, can you tell me if you guys have been experiencing any shortness of breath, coughing, fever, chills, vomiting, diarrhea?
No, nothing like that.
No, okay. And did your brother hit his head, neck, or back on the way down?
Yeah.
He did, okay. Sorry to hear. So I'm looking at the patient from 2 meters away. Is he just laying like that?
Yeah.
He is just laying like that. And is he interacting with anyone?
Yeah.
Yeah, he is.
No, he's not.
No, he's not. Okay.
No, he's not.
Can I see him breathing?
Yes, you can.
I can't.
You can.
Oh,
Sorry.
I can.
Yeah, you
Okay,
can.
sorry. And do I hear him breathing at all?
You do not hear any breathing.
I don't hear any breathing noises. Okay. And I'm looking at his circulation. What's his skin color like right now?
He is a little pale.
He's a little pale. Okay. And does he look diaphoretic, wet, blooding?
No.
No? Okay. So I'm going to walk up towards the patient. I'm going to make sure I'm standing in front of him. Hi, my name's Aidan. I'm a student paramedic. Please don't move your head.
No response.
No response. Okay, so I'm going to walk up. Hello, can you hear me? I'm a student paramedic.
No response.
No response, and I'm doing a trap squeeze.
No
No
response.
response, Camilo. If you could grab the C-spine for me. So I'm going to quickly do a deadly bleed check. Do it along the head, along the torso. Tell me when there's blood.
No blood.
No blood. And is there any medical alert bracelets,
No
necklaces, or
medical
tattoos?
alert bracelets.
None,
No.
okay.
No blood.
No blood. Okay, Camilo, I'll have you do a jaw thrust so I can look in the patient's airway. Do I see any blood, secretions, teeth, anything?
Nope.
No, okay. And I'm listening for breathing. Can I hear chest or see chest rise and fall?
Yeah.
I can, okay. So I'm gonna load and go this patient, and I am gonna put a blanket on him just due to hypothermia. I don't want him to get cold at all. The load and go is due to the mechanism of injury, due to the speed at which he was hit, and he is a pedestrian who's been hit by a car. Okay, so I'm gonna be looking for decap BLS. So deformities, contusions, abrasions, penetrations, burns, lacerations, and swelling. And I'm going to be feeling for tenderness, instability, crepitus, and swelling once again. So I'm palpating the forehead and behind the head here. Do I feel any asymmetry or blood?
You feel asymmetry, no blood.
Okay, and I'm feeling along the orbitals. Is there any deformities? And same thing for the jaw.
No deformities.
Okay, and I'm looking in the eyes. Are the pupils reactive to light?
Yeah.
And I'm looking in the ears, mouth, and nose. Is there any CSF blood or bruising?
No.
No, okay. So I'm going to move on, and I'm going to feel down the cervical spine. Do I feel any tenderness, instability, or step-offs?
You feel step off, yeah.
Step-offs, okay, partner. I'm going to have you apply a C-collar once I'm done with the rest of the neck assessment. So I'm looking for a JVD.
Yeah. No JVD.
No JVD, okay. Is the trachea midline?
It is midline.
Is there any tracheal deviation?
No tracheal
Do I
deviation.
see or feel any subcutaneous emphysema?
No subcutaneous
Okay,
emphysema.
sir, I'm going to feel on the rest of your chest here. I'm going to lift up your shirt.
No response.
No response, and I'm feeling along the clavicles. Any tenderness or instability?
It's stable.
Same thing for the sternum.
Stable.
And I'm feeling along his ribs. Any flailed chest, any fractured ribs?
No flail chest.
Any
No fractured ribs.
chest exertion that I feel?
No.
Any blood on my gloves?
No blood on your gloves.
No, okay. And I'm looking at the abdomen. Abdomen, is there any discoloration at all?
No.
I'm feeling for a AAA. Do I feel one?
No.
No, okay. And I'm palpating each quadrant. Do I see any grimace as I'm looking at the patient's face?
No.
Is there any tenderness?
No.
No, okay. So I'm lifting the pelvis up, down, in and out. Is it stable?
Unstable.
Unstable, okay. Well, I'm gonna have you go on the other side here. We're gonna do that. But rapidly before, I'm gonna feel the groin. Do I feel any incontinence or any tenderness?
Nope.
None, okay.
No incontinence.
And as I'm looking at the patient's face, do I notice any grimace as I palpated there?
No.
No, okay. On 3, 2, 3. It's gonna hurt a little bit. Okay, awesome. So I'm gonna go down the rest of the legs. I'm gonna put the blanket up here. Any deformities in the legs?
No.
No. And I'm feeling the pedal pulses. How do they feel?
Equal.
Checking the cap refills as well.
Under 2 seconds.
Under 2 seconds, sir. Can you push on my feet or my hands like a gas pedal, please?
No response.
No response. Sir, which toe am I holding?
No
No
response.
response. Okay. I'm gonna move up to the arms here. Was there any blood on my gloves?
No.
No. Okay. And I'm doing the same thing for the arms. Any blood on the gloves?
No.
Any deformities?
No.
Checking the radial pulses.
Equal.
They're equal. Okay. Sir, can you please grip my fingers?
No response.
No response. Cap refill on the thumbs.
Under 2 seconds.
Under 2 seconds. Okay. And sir, which finger am I holding here?
No response.
No response. Okay. Was there any blood on my hands after that one?
No.
No. Okay. And since the patient has a unstable pelvis, I'm just going to try to not move him, and I'm feeling for deformities, step-offs, or anything in the lumbar and thoracic area.
Nothing.
Nothing. Okay. So as of right now, the patient is a lone go due to mechanism of injury, because he was struck at a rate of faster than 30 kilometers per hour. The critical findings that we had was an unstable pelvis. He was pale, he was cold, he had step-offs in his neck, and the unstable pelvis once again. And the interventions that we did was the manual C-spine and spinal motion restriction, and the pelvis stabilization as well. The chief complaint was that the patient was unconscious or that he was hit by a car, and the GCS was of 3 because he was unresponsive in all categories, so 1 for eyes, 1 for verbal.